I would wash my hands and then I would go ahead and put my gloves on. Okay, so I'm going to go ahead and begin the assessment. I'm going to begin by assessing your arms. May I go ahead and see? Okay, color is normal. Skin is warm and dry to touch. Can you go ahead and do this for me? Okay, there is no clubbing noted. I'm going to go ahead and check your capillary refill. Okay, capillary refill is less than 2. I'll notice that there is no lesions on the arm, and there is no tenting. Okay, next I'm going to assess the hair. Okay, do you feel any tenderness?
No.
No? Okay, no tenderness is noted. Okay, there are no indentions and there is no perfusion. Hair is well groomed and evenly distributed. And you said there was no tenderness?
No.
Okay, and then there's no sign of pediculosis. And that's going to be it for the head assessment. Okay, go ahead and close your mouth for me. Okay, temporal mandibular joint is free from crepitus. Okay, go ahead and clench your teeth. Go ahead and clench again. One more time. Okay, temporalis and masseter muscles are equally strong. Cranial nerve 5 trigeminal is intact. Okay, next I'm going to assess your frontal and maxillary sinuses. Do you feel any tenderness?
No.
Okay, frontal and maxillary sinuses are non-tender. Okay, let me know if you can feel this.
Yes.
Okay, light touch sensory is noted. Okay, go ahead and smile for me. Go ahead and frown. Go ahead and puff. Go ahead and raise your eyebrows. Okay, cranial nerve 7, facial is intact. Okay, next, I'm going to go ahead and have you look straight. Okay. Okay, continue looking straight. Okay, pupils are equal, round, reactive, and accommodate to light. follow my finger, okay? Okay, cranial nerve 3, ocular motor, cranial nerve 4, trochlear, and cranial nerve 6, abducens, are all intact. Okay, you can go ahead and send that for me right there. Okay, go ahead and cover your right eye and go ahead and read this line for me.
T-E-F-P-O-T-E-Z.
Okay, go ahead and cover the other eye and go ahead and read this line for me.
T-E-F-P-O-T-E-Z.
Okay, now go ahead and take a seat. Acuity is 20/20 in the right and left eye according to the Snellen chart. In a real life setting, the patient would be 20 feet away from the Snellen chart, but due to the limited space for the assessment, the patient was not. Okay, if you can go ahead and stand up for me. Okay, first I'm going to go ahead and have you follow me. Go ahead, look down, look up. Okay, full range of motion is noted to the neck. Go ahead and put your shoulders up, down, up and behind the back, down and behind the back. Okay, full range of motion is noted to the shoulders. Go ahead and put your arms out, bend in, bend out, in, out. Okay, full range of motion is noted to the elbows. Okay, go ahead and put your wrist straight, go up, down, around, go ahead and go in, out. Okay, full range of motion is noted to the wrist. Go ahead and take a seat again. Okay, now I'm going to go ahead and test your strengths. Go ahead and resist up, down. Okay, go ahead and turn this way. Okay, go ahead and turn that way. Okay, cranial nerve 11 spinal accessory is intact and strong. Okay, next if you can go ahead and turn that way for me, I'm going to go ahead and check your posterior ratio. Okay, 1 and 2. Let me go ahead and check the front. Okay, anterior and posterior ratio is 1 to 2. Okay, next I'm going to go ahead and have you breathe in and breathe out. Okay. Go ahead, breathe in and breathe out. Do you feel any tenderness? Okay, no tenderness noticed. No tenderness noted, and chest expansion is symmetrical. Okay. going to go ahead and auscultate, which means listen to your breath sounds in the front and in the back. I'm going to go ahead and have you take deep breaths in and out, and I'll let you know when I'm done. Okay, go ahead and turn this way for me. Go ahead. Go ahead. Go ahead. I'm going to go ahead and go under your shirt. Okay, now I'm going to go under your shirt on the bottom. You okay? Yes. Okay. So breath sounds are clear over all the lungs. They are equal bilaterally, and there is no adventitious sounds noted. Okay.
×4, which is a normal finding. So we'll start with the HENT exam. So I'm going to assess his scalp for any lesions. I don't see any bruises. I don't see any bulging, anything like that. The head is normocephalic. Next, I'm going to assess his hair. It is coarse and thick. It's brown. I don't see any parasites, anything like that in the hairline, so that is normal as well. Next, I'm going to look at his face. It appears symmetrical, but we're going to test cranial nerve 7, so I'm going to have you smile, frown. Can you squint your eyes, puff out your cheeks? Okay, cranial nerve 7 is intact. This is the facial nerve. Next, we're going to go to the eyes. So I'm going to get my ophthalmoscope. Before I do this, I forgot to assess cranial nerve 5. So I'm going to have him clench his teeth. I'm going to assess the temporal and masseter muscles. Cranial nerve 5 is intact. I'm also going to assess the sinuses. So the temporal and maxillary sinuses, when I look at them, I don't see any redness or swelling right off the bat. So I'm going to palpate them and percuss. Okay, these are all normal findings. Did you feel any tenderness or pain when I did that assessment?
No.
No. Okay, so that's a normal finding as well. So now we'll move on to the eyes. First, I'm going to inspect his eyebrows, eyelids, and eyelashes, and those all look normal. Next, I'll inspect the external structures of the eye. So just looking at it, his iris looks intact. Pupils are 3 millimeters, which is a normal finding. His cornea appears to be intact. I don't see any hemorrhages. His conjunctiva looks normal, and the lacrimal ducts appear, he doesn't have any excessive dryness or tearing of the eye, so that's a normal finding as well. So next, I will do we'll do the Snellen eye chart to assess cranial nerve 2, which is the optic nerve. So I'm going to have you hold this little chart. It says to hold it about 6 feet from the eyes, and I want you to read the smallest line that you can see.
LT of PH.
Okay, good. So his vision is 20/20. This is normal finding. Cranial nerve 2 is attacked. Next, we will use the ophthalmoscope to assess the eye, the internal structures of the eye. So I will do, I'm going to do right eye only for the sake of time. So I will put this on my right eye to assess the patient's right eye. So when I'm looking at it, the macula and fovea centralis are visible. The retinal background appears normal. There's no hemorrhage. The pupil that I can see is normal. The cornea is intact. No redness or abnormalities. There's no foreign bodies in the eye. So everything looks intact from what I can see. Next, we will assess cranial nerves 3, 4, and 6. I'm going to start by doing a corneal exam. I'm going to check the pupils. So I will do corneal light reflex to make sure the pupils are equally round and reactive. I don't have a pen light, so I'm going to use the light on my ophthalmoscope. I want you to look straight ahead for me. I'm going to shine a light in your eye. Okay. All right, so the pupils are equally round and reactive to light and accommodation. This is a normal finding. Normally I would do this in a dimly lit room, but because we can't play with the lights in here, we're just going to pretend that it was dimly lit. Next, I'm going to check his points of gaze. So I want you to look straight ahead, and I want you to follow this ophthalmoscope with your eyes only. Don't move your head, okay? Okay, good. So there was no strabismus or nystagmus, so this is a normal finding. And next I'm going to do the cover test. So I would like for you to cover your right eye and look at my object. Okay, and now swap to the other eye and stay looking at my object. Good, now down. Okay. His eyes did not deviate, and I didn't see any bobbing, nystagmus, strabismus, anything like that, so that's a normal finding as well. So these all test for cranial nerves 3, 4, and 6. Next, we are going to move on to the ears. So I'm going to get my otoscope, and first I'm going to just, I'll come over here and I'm just going to inspect the ear. So the pinna appears when I pull it up and back, which is what you're supposed to do for an adult. I don't see any abnormalities. I do see a small amount of brown cerumen in the external canal of the ear. I'm going to palpate the tragus and the pinna. Did you feel any pain when I did that?
No.
No. Okay. Next, I'm going to use the otoscope to inspect the internal structures of the ear. Okay, there is a medium amount of brown cerumen present, but this is normal for most people. Let's see. I can visualize the cone of light. The canal is gray and pearly, so that's a normal finding. There's no redness or that I can see, so this is normal as well. Okay. Next, I'm going to assess for hearing. So I'm going to come around here and we're going to do the whisper test. So I'm going to stand behind the patient and whisper something, and I want you to repeat after me.
The cat in the hat.
Okay, so the patient's hearing is normal. Now we're going to assess for cranial nerve 8 by doing the Weber and the Ryan test. So we're going to do the Weber test first. I'm going to strike the tuning fork and put it in front of the patient's head, and I want you to tell me if you can hear the sound equally in both ears or better in one ear or the other, okay? Was that
Equally.
equal? Okay, so the Weber test is normal. Now we're going to do the Ryan test, and this test for air and bone conduction. So air conduction should be twice what bone conduction, or twice the length of bone conduction. So I'm going to strike the tuning fork, put it beside your ear, and you tell me when you stop hearing the sound and I will move it, okay?
Okay.
Okay. All right, so this is a normal finding. Air conduction was twice the length of bone conduction. So cranial nerve 8 is intact. So next we will do the nose. I'm just going to start by inspecting the nose. I'm going to palpate the, everything looks symmetrical, intact. From what I can see, I'm going to look up the nose with the otoscope, and I would change out the cover on this as well. Can you look up for me? Okay, I'm looking inside the nares. The nasal turbinates are pink and moist and intact. I don't see any drainage or exudate. Now we're going to test the patency of the nares. So can you put one finger over your nose and blow? And can you do it to the other side? Okay, good. So the nostrils and the nares are patent. And the bridge of the nose is midline, so this is a normal finding as well. Now we're going to go to the throat and mouth. So I want you to open up for me. I'm going to inspect the teeth. His teeth look normal. I'm going to use a light as well. Can you open up? Buccal mucosa is pink and moist. Dentation is normal. His pharynx is pink, not red, and there's no exudate, which is a normal finding. I'm going to look at his tonsils. They are 2+ in size, which is a normal finding. Can you open up wide and say ah for me?
Ah.
Okay. This checks cranial nerves 9 and 10. I would use the gag reflex to check cranial nerve 10, but I'm not going to gag him for the sake of this exam. Next, I'm going to have him stick out his tongue and move it side to side. Okay, this checks for cranial nerve 12, and it is intact. If I had gloves on, I would palpate the tongue and make sure I didn't feel any abnormal areas or see any dark spots, which I could not see during the exam, so that is also normal as well. So next, I'm going to inspect all of the lymph nodes. We'll move on to the neck. So I'm just going to do one side for the sake of this exam, but I will do pre-auricular, post-auricular, occipital, anterior and posterior cervical change, tonsillar, submaxillary, submental, and clavicular. So all his lymph nodes are freely movable, and they're non-tender. And did you feel any pain when I did that exam?
No.
So this is a normal finding.
So we're just gonna shut the door to provide for patient privacy. I'm gonna wash my hands. And I just need to verify your name and date of birth. Say E-Bear XX, thank you. Okay, so I'm here to do your head to toe assessment today, and what that entails is we're going to be checking that everything is okay. So we're just going to be taking a listen to your heart. We're going to take a listen to your lung sounds and your abdomen. Then we'll be doing a little bit of moving around just to check your joints, making sure everything's okay, and I'll be asking you some questions. Does that sound good? Okay, good. So you just raise the bed to proper working height for body mechanics, and we are going to get started. So, can I just have your full name, please? Ted E. Bear, thank you. And do you know where you are right now? At home, good. And can you tell me what day it is? Do you know what month we're in? April 22nd, yeah? All right. So, just gonna check. Pupils, take a look at them. Eyes are equal and reactive. Patient's affect looks good. Patient's making good eye contact. Good hygiene. You have really nice fur, Mr. Bear. So, I just ask you a few questions about your sleep pattern. Do you feel like you get enough sleep? Yeah, about how many hours would you say you got? About 6 hours? And is that adequate for you? Is that normal? Okay, sounds good. And what about nutrition? Do you eat a regular diet? Do you eat most of your meals? Okay, about how much of your meals would you say you eat? 100%? Awesome. Okay. And do you have any allergies to any foods or medications? No? Are you taking any medications? Okay. No, okay. So if the patient does have any allergies, we would ask what kind of reactions he has to whatever he's allergic to. So I'm gonna go ahead and check your vital signs. So I'm gonna check the blood pressure, the O2 sat, take the temperature. We will be checking the respiratory rate and the pulse for 60 seconds. Check the respiratory rate as well. And then looking up at the monitor, everything looks good and within normal limits, so that's good. Are you having any pain today? No. Okay, so on a scale of 0 to 10, 0 being no pain and 10 being the worst pain possible, what would you say? 0. Okay. If the patient did have pain, we would ask about the quality of pain. So, or palliative and severity. All right, so now we're just going to go ahead and check your heart sounds. Aortic, pulmonary, Erb's point, mitral, and tricuspid. And what we're listening for is the lumped up sounds and S1 and S2. So we're going to check capillary refill. Right, that's 2 seconds or less, so that's good. So we're going to check your pulses now, okay? Your temporal pulse. We'll do the carotid one at a time. Check the brachial pulses and the radial pulses. Roll your vagina aside a little bit. You can check the femoral pulses. We're going to listen to the popliteal pulses and the knee, both of them. The dorsalis pedis. And the posterior tibialis on both sides. And what we're checking for is the rate, strength, and regularity of the pulses. So now I'm going to take a listen to your lung sounds, okay? Grab the stethoscope here again. I'm going to listen in the front first, okay? All right. And I'm just going to take a listen posteriorly as well. Can I just have you sit up for me for a minute? Thank you. Going into C pattern. And we'll check laterally as well. Good. Look, sounds clear. You can lay back down. Thank you. Now we're just going to inspect your abdomen here. So I'm going to push the jaw knee aside again. First, we're just going to take a look at it. It looks pretty normal. No discoloration, no distension. So first, I'm going to listen for vowel sounds in all 4 quadrants. So I'm going to go ahead and listen to the left upper quadrant, the right upper quadrant, left lower quadrant, and the right lower quadrant. And we're just listening to make sure that for there have normal vowel sounds, so no hypoactive or hyperactive, because like if they were hypoactive, that could mean like constipation, but it sounds good, normal vowel sounds. So I would put on some thin gloves and just gently palpate the area for any distension, swelling, or discomfort, any pain. No. And Mr. Bear, do you have? How would you say your voiding patterns are? Are they normal? Do you go to the bathroom okay? Yeah. When was the last time you went to the bathroom? This morning. Good. Okay. So now we're just gonna do a little bit of range of motion. Off the gloves. Okay. Can you hold both your arms up for me? And what we're checking for is palmar drift. Can you grasp my hand? And can you push against my hand? So, resistance is good. Eye movement is spontaneous. Movement is spontaneous. The patient verbalizes on his own, spontaneously. So he would score a 15 on the Glasgow Coma scale. So that sounds good. Okay, so now I'm just going to go ahead and check your head. We're going to check your skin, neck, check the back. We already checked the abdomen. We check the back. Need you to turn over a little bit. We check the coccyx as well for any irregularities in the skin. No bruising in the extremities. Everything looks good. All right. So now I'm going to go ahead and lower the bed back in the lowest position for the patient's safety. We're going to make sure the patient's comfortable. He has his call light. Is there anything else I can do for you, Mr. Bear? No? Do you have any questions for me? Okay, well, if you need anything from me, feel free to just hit your call bell there. And that's it. So then I would wash my hands and exit.